Hi, I'm State Senator Michael Weber from Michigan. I wish I could be there with you this morning in Chicago, but I want to begin by expressing my deep gratitude for the work you do to support those seeking mental health care across our country. Thank you from the bottom of my heart to Mental Health America and the Mental Health Association of Michigan for nominating me and for honoring me with the 2025 Legislative Champion Award. This means a great deal to me. I accept this award not just for myself, but on behalf of the many patients and families in Michigan who inspire and guide my work, advocating that mental health care is health care. Every day, families place enormous trust in Michigan's mental health care system. They trust that their loved ones will be treated with dignity. As lawmakers, we have a moral obligation to make sure that our government is protecting vulnerable patients receiving mental health care. Over the past 2 years, I've listened to parents and former patients share their experiences about Michigan state-run psychiatric hospitals. One thing is clear: for far too long, those seeking mental health care have not received the same adequate treatment. No vulnerable person should ever be left unprotected in a system designed to heal them. That's why I turned to Michigan's independent Auditor General for answers. They investigated the Office of Recipient Rights, which is Michigan's patient complaint system. The audit confirms that our state government is failing to protect the rights of mental health care patients. Nearly 30% of sampled patient complaints alleging abuse, neglect, serious injury, or death were not retrieved or acted on until 2 to 12 days after being filed. This should have been done within 24 hours. Video surveillance and audio recording capabilities at state psychiatric hospitals were often missing or not working. For over 40% of the investigations reviewed, video and/or audio evidence could have helped solve patient complaints. These are just a few of the stark findings. Now that we have clear insight into our mental health facilities, we can take real steps to protect patients and the families who rely on this help. Through my work, I introduced legislation to add representatives from Disability Rights Michigan, Mental Health Association in Michigan, and ARC Michigan as members to the Recipient Rights Advisory Committee. I have also introduced legislation that would require hospitals to have patients' written notice of their rights. This award is a reminder of the progress we've made. But our work is far from over. Every vulnerable person in Michigan deserves the care that we've sworn to protect. Every patient deserves to understand their rights. And every family deserves honesty and transparency from their government. That's why I continue pushing for legislation to strengthen patient rights protections and bring transparency and oversight to our mental health care system to ensure people in crisis are treated with dignity and that families have the information they're entitled to. Mental health care is health care, and as long as I'm serving in Michigan's capital, you'll have a committed advocate working every day to make things better. Thank you again for this incredible honor, and thank you even more for the work that you do for standing up for vulnerable young people and adults who need care, compassion, and a safe place to heal.